recording?
Hit record.
Hello, everybody. My name is Victoria. This is my speech for my speech summer course. I'm just going to start. This is an informative speech. Imagine you're going through a traumatic event, such as a death in the family, or an assault, or extreme home life stress. You're sad, upset at the situation, and have withdrawn from normalcy. Of course, these emotions are normal and common, but with situations like these, weeks later, these feelings of deep sadness aren't going away. You speak to your primary care provider and have now been diagnosed with major depressive disorder, commonly called depression. As healthcare professionals working at a primary care office, depression is a common diagnosis that we see frequently among our patients. And as many of you know, I myself struggle with this diagnosis. Today, I will be informing you about depression by explaining the symptoms, the treatment, and the stigma behind the disorder. So according to the American Psychiatric Association, diagnosing major depressive disorder can be done by observing a patient having 5 or more of the following symptoms for 2 weeks or longer. Symptoms are depressed mood, loss of interest or pleasure in activities, significant weight change such as gain or loss, fatigue, feelings of worthlessness, inability to focus or concentrate, and recurrent thoughts of death or suicide. So there are multitudes of ways that we can screen for depression. As employees of this practice, we are familiar with the PHQ-9 assessment. This assessment is the most widely used tool to diagnose depression and to be utilized for monitoring and measuring the severity of the disorder. So what is depression exactly? Depression biologically is the chemical imbalance in our brain. While there's no clear-cut cause, what it basically is a lack of neurotransmitters. Neurotransmitters are the chemical messengers in our brain that are said to regulate our mood. Depression is a lack of these transmitters, which inhibit proper mood balance and control. So now that we know about symptoms and causes, let's talk about treatments. So there are multiple treatments. One of our first treatments that we know about is medication. Medications that we do are SSRIs, TCAs, and atypical antidepressants. So these medications work by balancing the neurotransmitters in our brain. And according to a study in 2005 by the National Institute of Mental Health, over 50% of patients who started on initial therapy have to have their therapy switched or increased in order to effectively control their symptoms. This shows that antidepressant therapy is very trial and error, and it's still being researched. Another treatment option is psychotherapy. So there are multiple types of psychotherapy. That is cognitive, behavioral, and psychoanalytic, plus more. So the benefits of these therapies include the resolution of our personal issues and learning how to deal with coping skills. So the different types of therapies means tailored treatment according to what suits the patient's conditions best. So the last types of treatments is going to be lifestyle changes. Lifestyle changes such as improved diet, exercise, meditation, developing healthy sleep habits, and stress management have been shown to improve symptoms of depression, according to an article written by Dr. David Sack for Psychology Today. These lifestyle changes can keep stress at bay and can help improve overall mental health. Utilizing these changes can also promote feelings of happiness, self-esteem, and optimism. So now that we've talked about the treatments, let's move on to one of the biggest things, the stigma of depression. So depression, along with other mental and psychological disorders, have long since been a topic of discussion, not only in medicine, but in the public eye. People who have depression can be seen in an unfair light and can be judged according to their condition. So stigmas can lead to discrimination, including avoidance from other people and negative views of the person with this disorder. Effects of the stigma can be reluctance to seek treatment, lack of understanding from friends and family members, fewer opportunities for job offers, social interactions, and housing. So ways we can combat and normalize psychological disorders. According to the National Alliance on Mental Illness, Education is the most important way to combat stigmatic views of people with psychological disorders. Depression, much like heart disease and asthma, is a medical diagnosis that patients cannot control. People should not be categorized by their condition. So in conclusion, depression, although it is a psychological disorder, can be diagnosed by evaluating multiple signs and symptoms, utilizing screenings by primary healthcare providers, and treatments available to our patients so that they can continue to live their lives normally. Although mental disorders are stigmatic, with our medical knowledge and acceptance of it, we can change the way people look at depression. As professionals in the field of medicine, we have a duty to recognize, acknowledge, treat, and accept major depressive disorder that our patients live with. Thank you.
That was the best speech I've ever